PMS, or premenstrual syndrome, and PMDD, which stands for premenstrual dysphoric disorder, are both conditions related to the menstrual cycle, but they are different and should be treated differently. Welcome back to the FemHealth channel, a health education channel by Doctors for You. PMS is very common. Most women experience some symptoms like mood swings, bloating, headaches, or breast tenderness in the week or two before their period. These symptoms are uncomfortable but usually manageable, and they go away once the period starts or soon after. PMS can make you feel a little more emotional, tired, or physically uncomfortable, but it doesn't usually cause serious problems with work, school, or relationships. PMDD, on the other hand, is much more intense. It's a serious medical condition where emotional and physical symptoms are so severe they interfere with daily activities and relationships. Women with PMDD might experience extreme sadness, anger, irritability, hopelessness, or anxiety. Some even have suicidal thoughts. Physical symptoms like cramping and bloating can also be worse than in typical PMS. PMDD symptoms usually begin about a week before a period and ease up within a few days after it starts, just like PMS, but the emotional effects are far more disabling. Doctors think that PMDD and PMS are both linked to hormonal changes in the menstrual cycle, particularly sensitivity to changes in estrogen and progesterone levels. However, in PMDD, the brain's reaction to these hormone shifts is much stronger, especially in areas that control mood. The main way to tell the difference is by looking at how intense the symptoms are and how much they interfere with daily life. If a woman has PMS, she might feel more emotional, a little moody, tired, or physically uncomfortable before her period. But even if she's annoyed or sad, she can usually still function, go to work, go to school, hang out with friends, take care of herself. With PMDD, it's much more serious. A woman with PMDD might feel like she can't get out of bed, can't concentrate at work, fights more with people she loves, or even thinks about hurting herself. Physical symptoms like bloating, breast tenderness, or headaches are often worse too. Women with PMDD often say they feel like a completely different person in the days before their period. Both PMS and PMDD symptoms start in the luteal phase, about 1 to 2 weeks before the period, and stop within a few days after the period starts. But if the symptoms continue all month long or aren't tied closely to the cycle, something else might be going on. Treatment for PMS might involve lifestyle changes like regular exercise, healthy eating, and stress management. Over-the-counter pain relievers or occasional use of hormonal birth control can help. PMDD usually needs stronger treatment. Doctors might prescribe antidepressants even if used just during the second half of the cycle, hormone therapy, or other medications to manage the emotional and physical symptoms. Therapy, especially cognitive behavioral therapy or CBT, can also be very helpful. While PMS is common and often mild to moderate, PMDD is much rarer and much more serious, and it often requires medical help to manage.